So now let's start with lymphomas. So lymphomas are the one which are involving the lymphoid organs. So leukemia was involving the peripheral blood, while lymphoma is going to involve the lymphoid organs. So we have two types of lymphomas. One is Hodgkin's and other one is non-Hodgkin's lymphoma. Hodgkin's lymphoma is the one which is going to occur in the cervical lymph nodes and in the mediastinal lymph nodes. Okay, and it is going to characteristically have a contiguous spread of lymphoma. Okay, so meaning the cervical lymph nodes, if the upper cervical lymph node is going to be involved, it is going to contiguously going to involve the axillary lymph nodes next. Okay, so that is called as contiguous spread. And then this non-Hodgkin's lymphoma here, it is going to involve the Waldeyer's ring and also the mesenteric lymph nodes. Okay, and here the spread is going to be non-contiguous. So randomly any lymph node is going to be involved. And then not just lymph node, it can be extranodal as well. Okay, so both lymph nodes and extranodal lymphoid organs like spleen, they can also be involved. Okay, so now let's start with Hodgkin's lymphoma first. So under Hodgkin's lymphoma, the most characteristic thing in Hodgkin's lymphoma is going to be the Reed-Sternberg cell. So Reed-Sternberg cell, apart from that, there is another term in which the Hodgkin's lymphoma is important. The Reed-Sternberg cell has to occur in a background of polymorphous population. Okay, so this polymorphous population is going to characterize the Hodgkin's lymphoma. So the Reed-Sternberg cells are going to be derived from the germinal center of the lymph node or from the post-germinal B cells. Okay, so origin of Reed-Sternberg cells is going to be germinal center or post-germinal center B cells, and these Reed-Sternberg cells are going to secrete some interleukins and cytokines like interleukin 13, interleukin 5, then macrophage colony stimulating factor, TGF beta. So all of this interleukins are in turn going to recruit the inflammatory cells. So those inflammatory cells actually compose the polymorphous background. Okay, so the pathogenesis of Hodgkin's lymphoma is going to involve the formation of this Reed-Sternberg cell, and these Reed-Sternberg cells secrete some cytokines, and those cytokines are the ones which are responsible for recruiting the inflammatory cells which form the polymorphous background. Okay, so the polymorphous background, you are going to see all kind of WBCs, basically neutrophils, eosinophils, plasma cells, lymphocytes and histiocytes. So all of these cells are going to be seen in the background of this Reed-Sternberg cell. So what is the mutation which actually happens? So most commonly we are going to see aneuploidy, and apart from that there is a gain of chromosome 2p. So whenever there is gain of chromosome 2p, here it is going to lead to the activation of a pathway called as NF-kappa B. So NF-kappa B pathway is activated. So remember, NF-kappa B pathway activation is always going to lead to cytokine production. Okay. So normally also when cytokine production is needed, the cells will actually trigger their NF-kappa B pathway. So because of gain of chromosome 2p in Hodgkin's lymphoma, NF-kappa B pathway is going to be activated. And we must have known that some of the Hodgkin's lymphoma subtypes are going to be associated with Epstein-Barr virus. So Epstein-Barr virus is going to cause polyclonal B cell activation, and it is known for causing many other lymphomas as well, B cell lymphomas. So here again, the pathogenesis involved in EBV will be, this EBV is going to have a membrane protein called as latent membrane protein LMP1. So this LMP1 is going to activate the NF-kappa B pathway again. Okay. So that again is going to lead to cytokine production. So this is the pathogenesis involved in Hodgkin's lymphoma. So we are speaking about the Reed-Sternberg cells, right? So we have many types of Reed-Sternberg cells, but the classical one, which we call it as the very first identified cell, was the classical RS cell. So this is going to have a characteristic morphology. So this can come as an image-based question as well. So if you see, the cell is going to be a giant cell. So it's a very large cell, and in which you are going to have a binucleate structure. Okay, so the nucleus is going to be binucleate, and then it is going to be a mirror image. So if you see, this part of the nucleus is going to resemble this part. So this is a mirror image of the nucleus. Apart from that, there is going to be a prominent eosinophilic nucleoli. So this prominent eosinophilic nucleoli is very, very characteristic of Hodgkin's lymphoma. So this prominent eosinophilic nucleoli is there, and then surrounding this nucleoli, you are going to see a small halo. So this perinucleolar halo is going to be seen around the nucleolus. So this appears like the eye of the owl, right? So it is going to be called as owl eye appearance. Okay. So RS cells, it is going to be a giant cell with binucleate mirror image nucleus having a prominent eosinophilic nucleoli with a perinucleolar halo. So classical description of an RS cell. So, and it is called as the owl eye appearance. So I'll just remind you of some other owl eye as well. So owl eye appearance, we also use it for cytomegalovirus. So in cytomegalovirus as well, you are going to have a what is that called as inclusion. So those inclusions are here classically basophilic inclusions. Okay, while it is eosinophilic prominent nucleoli in RS cells, it is going to be a basophilic prominent inclusion seen in the CMV. So CMV, as the name suggests, cytomegalo, meaning the cell is again going to be a very large cell, and in the nucleus you are going to see this basophilic inclusion. Okay. So this RS cells can also be present in some other conditions. So they are called as RS-like cells because RS cells is classified for Hodgkin's. So RS-like cells are going to be seen in some other conditions, but in these conditions, there is not going to be any background polymorphous inflammation. Okay, so no background polymorphous population is going to be there. Okay, so what are those conditions? We can see it in Epstein-Barr virus related disease, which is the infectious mononucleosis. In infectious mononucleosis, you get a characteristic cell in the peripheral smear. So these are called as Downey cells. So these are atypical lymphocytes basically. This is the image of the Downey cell here. So look at the cytoplasm. So this is the size of the normal RBC. So nucleus of the small lymphocyte is going to resemble the size of the normal RBC, right? But look at this lymphocyte here. It is quite big and with abundant amount of cytoplasm as well. So this is an atypical lymphocyte called as Downey cell in infectious mononucleosis. And the Downey cells are nothing but CD8 positive T cells. Okay. So these RS-like cells can be seen in infectious mononucleosis. Apart from that, you can also see this in diffuse large B-cell lymphomas, then ALCL, which is anaplastic large cell lymphoma, which is a T-cell lymphoma, and then some other malignancies as well, like carcinomas and sarcomas. Okay. So what is the presentation of Hodgkin's lymphoma? So as I mentioned, they are going to have contiguous spread of the lymph nodes. So they'll have multiple lymph nodes which are being prominent. So painless lymphadenopathy, especially in the cervical and the axillary group. Then they'll have a typical kind of fever called as the Pell-Epstein kind of fever. So in this, the fever is going to come for 2 weeks and then it will go away for another 2 weeks. So again, it will recur. So this kind of recurring type of fever is going to be there in Hodgkin's lymphoma called as Pell-Epstein fever. And then there is going to be B symptoms which are weight loss and night sweats. So they characteristically present with night sweats. At the night they'll wake up while sweating. So this night sweats can be seen, and these are called as the B symptoms associated with Hodgkin's lymphoma. And sometimes some paraneoplastic syndromes are also associated with Hodgkin's lymphoma. And those are secondary amyloidosis. So in secondary amyloidosis, what was the type of amyloid? Yes, it is going to be AA amyloid. So amyloid associated. So it is because of the inflammation associated, right? So it is composed of the SAA protein, which is an acute phase reactant. So inflammation is there. So there is going to be secondary amyloidosis AA. And then there is another classical finding in Hodgkin's lymphoma, which is a paraneoplastic syndrome again. The patient is going to complain of pain in the lymph node after consuming alcohol. Okay, so after they consume alcohol, they'll have lymph node pain. So normally it is painless. Now with alcohol, they are going to develop pain. So that is paraneoplastic syndrome here. Then coming to the classification of Hodgkin's lymphoma, they are classifying it into classical type and non-classical type. So the pathogenesis is going to be different and even the immunophenotype is going to be different. So classical type is further subdivided into subtypes. So the first one will be the nodular sclerosis. This nodular sclerosis is the most common type of Hodgkin's lymphoma worldwide. So as the name suggests, there is going to be nodule formation and there is sclerosis. So sclerosis means collagen, right? So collagen is going to be there and this collagen is going to form fibrous bands. So separating the lymphoma cells into nodules. So that is why it is going to appear like a nodule. Nodule is there and in between you are going to see fibrous bands like this. Okay. So characteristically, nodular sclerosis is going to involve the mediastinum. So the history, if they give the mediastinal lymph node and then with a young adult presenting with a Hodgkin's type of presentation, then you'll have to think about the nodular sclerosis. And here EBV association is not very common. So it's quite rare in nodular sclerosis. And the type of RS cells you see here is called as the lacunar RS cell. Okay. So here the RS cell is actually going to be, the cytoplasm is going to appear as if it is clear, and that thus looks as if the cell is sitting in a lacuna. Okay, and it is actually an artifactual thing only, which comes after processing the tissue. So in this image, if you see, this is an RS cell. So this cell is going to be sitting in this halo kind of thing. So it is called as the lacunar RS cell. So nodules, I mentioned, the nodules was because of the sclerosis actually. Then moving on to mixed cellularity. So mixed cellularity, as the name suggests, there is going to be mixed kind of cells. So especially the polymorphous background which we see in classical in the Hodgkin's lymphoma, right? So that is going to be very much abundant in mixed cellularity. Lots of eosinophils, plasma cells will be seen. So mixed cellularity is the most common type of Hodgkin's lymphoma in India. So worldwide it is nodular sclerosis, while in India it is mixed cellularity. And here the age group of presentation is biphasic. Okay, in nodular sclerosis it was young adults, while in mixed cellularity both young adults and elderly people more than 55 years of age group are going to be affected. And this mixed cellularity is the type which is most commonly associated with B symptoms. Also with EBV association and HIV association is going to be very much common here in mixed cellularity. And the type of RS cells which we see here is the classic RS cells, the binucleate proper ones. Okay, and the third type of classical Hodgkin's lymphoma is a lymphocyte rich type of Hodgkin's lymphoma. This is going to be present in elderly males, and here the type of RS cells is usually mononuclear RS cells. So not necessarily binucleate, mononuclear and binucleate, both mononuclear and binucleate kind of RS cells will be seen in lymphocyte rich. And as the name suggests, there is going to be lots of lymphocytes, lymphocyte rich. Then the fourth type of classical Hodgkin's is lymphocyte depleted or lymphocyte poor Hodgkin's lymphoma. It is going to have a poor prognosis. The worst prognosis out of all is for this lymphocyte depleted one. And here the type of RS cells which we see are called as the mummified or the pleomorphic RS cells. Okay, so each of the subtypes are going to have different type of RS cells. Nodular sclerosis, it is the lacunar RS cell. Mixed cellularity is the classical binucleate one, while in lymphocyte rich it is both mononucleate and binucleate. Lymphocyte poor or depleted, it is the mummified or the pleomorphic RS cells. Then moving on to non-classical Hodgkin's lymphoma. So under this we have one subtype only, which is the nodular lymphocyte predominant Hodgkin's lymphoma. So NLPHL. So as the name suggests, here again there is going to be formation of nodules, and there is going to be lots of lymphocytes. So there is nodules like the form like in nodular sclerosis here. This is again going to form proper nodules here. And then this variant NLPHL is also called as the lymphohistocytic variant because there is going to be abundance of lymphocytes and histiocytes in this variant. And in NLPHL, there is not going to be any association with Epstein-Barr virus, and classically it is going to be a young adult again presenting with the lymphadenopathy. And out of all, this has the best prognosis in Hodgkin's lymphoma. And the type of RS cells which we see here are called as the popcorn cells or the LH cells, lymphohistiocytic cells. Okay, popcorn cells because they are going to appear like a popcorn. So like the kernels of the popcorn, it is the nucleus is appearing like multilobated. So it is called as the popcorn kind of an RS cell. Okay. Then we'll come to the immunophenotype. I mentioned that the immunophenotype of the classical and the non-classical Hodgkin's lymphoma is different, right? So in classical RS cell, that is classical Hodgkin's lymphoma, the RS cell is going to be positive for CD15, CD30, then PAX5. PAX5 is a B cell marker, right? So PAX5 is going to have an attenuated Golgi positivity in this. Attenuated Golgi positivity will be there. And then apart from that, here the CD45 is going to be negative and CD20 is again going to be negative. Okay. Normally being a B cell lymphoma, it should express CD20 and then PAX5 should be strong, but here this classical Hodgkin's lymphoma, it is going to have CD20 negativity and attenuated PAX5 positivity. And in fact, lymphoma, normally every lymphoma, it is leukocytes are going to express CD45, but here classical Hodgkin's lymphoma is going to be CD45 negative, which is LCA, right? So CD45 negative, CD20 negative, but CD15-30 classically positive along with PAX5 attenuated positivity. So in this, the CD30 is going to be the most sensitive marker, while this PAX5 is going to be the most specific marker. Okay. Then in NLPHL, if you see, the immunophenotype is going to be, here it is going to be CD45 positive, CD20 positive like that of normal B cells, and then BCL6 is going to be positive. While CD15 and CD30, which are positive in classical Hodgkin's, is going to be negative over here. So this immunophenotype is very, very important. You'll have to remember it. So previously, the staging of Hodgkin's lymphoma was classified based on the Ann Arbor classification. Now it has been changed to Lugano classification. So it is basically modified Ann Arbor staging only. So it is called as the Lugano classification. So coming to the prognostic factors in Hodgkin's lymphoma, elderly age group, like more than 45 years of age group of male, then hemoglobin, anemia less than 10.5, then TLC, which is more than 15,000, and absolute lymphocyte count, which is less than 600, that is the lymphocyte depleted. So in that case, and then stage 4 disease, all of Ann Arbor stage 4 or Lugano stage 4. So all of this is going to represent poor prognosis in Hodgkin's lymphoma. So treatment for Hodgkin's and non-Hodgkin's is going to be different. That is why it is necessary to differentiate between Hodgkin's and non-Hodgkin's, because Hodgkin's as such has a good prognosis except for lymphocyte depleted or the lymphocyte poor one. Okay, but non-Hodgkin's lymphoma, it depends on the type of the lymphoma, whether it is a good prognostic or a bad prognostic lymphoma. So in Hodgkin's lymphoma, we are going to use a regimen called as the ABVD regimen.